therapy is a research-based use of music by a licensed music therapist to help people across all ages, cultures, and clinical populations improve their quality of life. I'm going to break that down because it's kind of a lot. So, research-backed field simply means that there is published research out there that shows that music is an effective tool to help individuals achieve their goals. A licensed music therapist means that this person has completed an accredited program. They've passed all of their clinical hours, they've passed the board certification exam, and they are licensed to practice as a music therapist. And that last piece, improved quality of life, needs a little bit more breaking down. So I want to look at that a little more closely. So improving quality of life is kind of a broad term. What can this mean? It means that I can use music as a tool to achieve a non-musical therapeutic goal. Now this can happen one-on-one, or it could happen in a group session, which in many long-term care facilities, memory care facilities, you may see group sessions happening with musicians who come to visit the residents there. It really just depends on the client and on their goals, and of course where they're receiving these services. Music therapists can evaluate their patients' strengths and needs, and they can develop a treatment plan that's tailored to that individual to create music experiences and tasks that can help them practice their skills. And we can do this by singing, by playing instruments, by listening to music, and even writing music in some cases. And some of the areas that we can work on for goal setting in a music therapy session could be enhancing learning and memory, to help develop or rehabilitate speech, to promote physical motor rehabilitation, to help decrease pain, to help manage stress, and to help express emotions. Now that we understand a little bit more about the different pieces of using music as a tool and some of the areas that we can help individuals achieve goals, let's look at where we work very briefly. So a music therapist can be found in an inpatient medical facility, in a hospital, long-term care facilities, nursing homes, and even private practice. In those settings, music therapists often work with other healthcare professionals to help develop treatment goals. And in some cases, they may even co-treat with them. And so in a single session, you may have two clinicians working with your loved one. So some of these people include psychologists or social workers, medical personnel, rehabilitation therapists such as speech therapists, physical therapists, and of course the families and caregivers. And in some cases, when it's possible, the patient themselves can have a say in their treatment and their goals that they would like to achieve. And so all of these possibilities just really ensure that we're looking very closely at the individual and making sure that the music experiences are personalized to them. And I keep emphasizing that personalization because it's a pretty important part of what we do. And I'll talk about that more as the presentation goes on. So now that we've looked at some background information on music therapy in general, let's look at how music is helping older adults specifically. So what are some challenges that your loved ones with dementia face? We may have, memory loss, loss of independence, decrease in, cognitive functioning, mood changes, right? These are some things that we may see in the dementia population. Now, these are some of the things that music therapists can do to address these needs in older adults. We can use music as a tool to help with attention and memory, with sensory stimulation. We can use music to help with gait training or with strength and endurance exercises to kind of help maintain our physical health as much as possible. In communication, we can use music to help with speech and also nonverbal communication because we can use music to communicate as well. We can use music in a social or emotional context to help improve our mood, to facilitate emotional expression, to socialize with another person and share a connection through music. And then you can also use music to help with activities of daily living, such as eating, toileting, or personal hygiene. So I wanted to briefly look at just some of the more, specific goal areas that music can help with. So specifically, sensory stimulation, by just kind of waking someone up and helping them kind of orient to their environment and where they're at. You can use music to provide structure to routines. Music in itself is very structured, and so it can provide a really good structure or template to completing tasks. It can even help, transition from one activity to another, one task to another. We can use it, like I said, for communication and socialization. Putting on a song and asking someone questions about it, or sharing a memory or experience related to that song, is really facilitating a personal connection between those two people. We can use it to improve mood and increase energy. I'll talk a little bit about that mood piece in a minute. We can use music, similarly to improve mood, but also to decrease anxiety and help promote relaxation. And we can decrease stress and agitation in a similar vein. And those things may help improve our sleep. It can enhance memory recall. And I'm going to get to that specifically in a moment. I have several examples of that in the presentation today. And this one's one of my personal favorites, to facilitate life review through music. So I'm just going to very briefly describe that. If you use personal music that an individual is connected to and may have memories around, Sherry gave the example earlier of a song that made her think of her wedding day, right? There was an instant connection to that song and that memory. If you can use music that an individual connects to in that way, you can discuss their life and they can share their life story with you. And I think that is a really powerful way to access memories, but also to honor someone's life. And so that's a pretty special activity that music can facilitate. So now we've looked at all of these areas, very briefly, of how music can impact individuals with dementia. I want to very briefly discuss why this happens, or potentially how is this happening. And the specific science behind the relationship between music and dementia is still being researched every day, because in the last 2 decades, there's been such an increase in neuroscience research and the new technology that's allowing us to really look at the brain more deeply. But there are some ideas about how this connection works, and I wanted to briefly share that with you. The first one is this idea that memory and emotions are connected, and we can use music to access that connection. So if you think of a spider web, there's all these different spots or nodes where things connect. And if you look at this idea of emotion connecting to memory, music is helpful in our emotions. It portrays emotion. And so using music to access someone's mood or their emotions can also help us access their memories. So this is one thought or scientific idea about how this relationship is happening. There are also some ideas that there's a link between biological processes and our overall mental well-being and how we feel, our mood, our emotion state. And so music can potentially help regulate someone's heartbeat or their breathing rate, and by that way may potentially help to decrease agitation and can promote relaxation. And so that's one way that we can help improve someone's mood. If they're feeling anxious, they're short of breath, we can play some music and try to breathe along to the music to help decrease that frustrated or agitated state and try to promote relaxation. You can also look at this from a more person-centered approach. It's kind of a psychological lens, if you will, and the relationship between patient and caregiver can also impact quality of life. And so I've referenced how music can help with socialization and a connection between two individuals. And so using music in our everyday life to provide opportunities for caregivers and loved ones to talk with one another and share memories can also impact quality of life. And so the last thing I wanted to just share briefly is that familiar music, preferred music, which I keep going back to this idea of preference, it's predictable and it's memorable and it can provide a sense of security and comfort. And so if thinking back on this idea of transitions between different activities, if you know someone who struggles with those transitions, then maybe providing familiar music at every transition can kind of help ease some of that anxiety because there's a sense of comfort from something that's familiar. And I think that's something that's also really important to talk about too, is this idea of comfort. So I have two examples of individuals that are interacting with music in very different ways. But they provide such a wonderful example of how music can access memories. And this first one has circulated a lot on the internet over the last year or so. But just so you know a little bit about this individual, she was a prima ballerina in her youth. And so they're playing music for her from Swan Lake, and you can just see her response to that music that's familiar to her. It takes her a moment to make a connection.
Normal, cariño mío, ¿cómo no va a emocionar? ¿Y tú nos emocionas a nosotros, bailando también. Hay que coger la punta, ¿verdad?
And so it's just a very simple example of sharing that emotional connection, that social connection, which is so powerful. And then seeing her just come to life and accessing those memories. I mean, dancers spend countless hours learning their dances, and the music in this case, I think seeing her face says it all, that it really stuck with her, and it took her a moment to process it, but then you see her move her arms, she remembers her dance. And so it's really powerful to give her that moment of autonomy, to give her that moment to express that, something that was such a big part of her life and her youth, and it made an impression on her. And so that's just one example. The second example I have is, let's see, there it is. So this is part of a documentary that was called Alive Inside. It was in 2014, and I'm just going to show you a snippet of this piece. This featurette is about 6 minutes, and the documentary is even longer. This was also circulating on the internet, and I'm going to start it at a point where you don't get so much background on the individual, but you'll get kind of pieces of it where someone that works at the facility where he lives mentions that he was a more quiet, disconnected person. He didn't really socialize. He doesn't really speak a lot. And then you'll see kind of how he responds to the music in the video. And Dr. Oliver Sacks, who was a psychologist and researcher and interested in the topic of music and the brain, kind of narrates and speaks a little bit to what's happening in this video. So here we go.
Inert, maybe depressed, unresponsive, and almost unalive.
Henry.
Yeah.
Henry.
Yes, sir.
I found your music. You want your music now?
What do you want
Okay,
me?
let's try your music, okay? And then you tell me if it's too loud or not.
Then he is given an iPod containing, we know, his favorite music. And immediately he lights up. his face assumes expression, his eyes open wide. He starts to sing and to rock and to move his arms, and he's being animated by the music.
And he used to always sit on the unit with his head like this. He didn't really talk to much people. And then when I introduced the music to him, this is his reaction ever since.
The philosopher Kant once called music the quickening art, and Henry is being quickened, he's being brought to life.
Yeah.
I'm going to take the music for 1 second, okay? Just to ask you a few questions. Okay? I'm going to give it back to you.
Uh-huh.
Okay.
The effect of this doesn't stop, because when the headphones are taken off, Henry, normally mute and virtually unable to answer the simplest yes or no questions, is quite voluble.
Henry,
Yeah.
do you like the iPod? Do you like the music you're hearing?
Yes.
Tell me about your music.
Well, I don't have none, I mean.
Do you like music?
Yeah, I'm crazy about music. You play beautiful music, beautiful sound. Beautiful.
Did you play music when you were? Did you like music when you were young?
Yes, I went to big dances and things.
What was your favorite music when you were young?
Well, I guess, well, Cab Calloway was my number one band guy I liked. That's the hold it, the holly, the hilly, the woolly, the milly, the holly, the
What was your favorite Cab Calloway song?
Oh, I'll be home there for Christmas. Oh, you can count and plan on me with plenty of snow, mistletoe, present wrapped around your tree. Ow!
So in some sense,
I love that little ow at the end. So you get a little glimpse into his personality and the way he listens to music and he recalls it, just in that little snippet. But you can see how after the music stimulation, if they ask him simple yes and no questions, he begins to talk to them. And this is someone that they've described previously as minimally verbal, doesn't tend to socialize. And so again, we're really honing in on this idea of using music as a tool to provide an opportunity for an emotional or social experience, with the facility workers or his loved ones and himself. And so that's really the piece that I hope you take today. If you take one thing, is the idea that music can be a tool to open that door for meaningful memory making, for experiences where you can interact with your loved one and learn a little bit more about their life, about their story, or recall it together with them, those moments that you've lived together. So it just, depends on the person and the relationship you have with them, but there's many opportunities and possibilities of what you can learn about your loved one through music or recall with them about life.
Henry is...
So I'm focusing now on this big piece that I've been mentioning a lot, is the idea of preferred music. So using music as a tool is wonderful, but the piece that I think is the most valuable to remember is preferred music. That's the piece that music therapists really focus on, is using preferred music. Doesn't matter necessarily if we're singing it or if we're listening to it or if we're writing a song. The foundation that we start with as best we can is preferred music. And what that does is, again, that familiarity and comfort can provide structure to routines, which may help decrease agitation, which may help in routines that have to happen every day, such as, hygiene, brushing our teeth, taking a bath. Using music during those times may help. Promoting communication and socialization. Again, you've seen two examples of how using music can connect to a memory and we can talk about it, we can socialize and have that experience together. It can enhance memory recall. You heard the gentleman say, oh yeah, I went to lots of dances when I was young. Those little moments where we can recall things about life after listening to music and talking about the music together. And again, that facilitating life review through music is one of my favorites. I have so many patients that I've worked with that I'll play music with them and then just ask them simple questions about their life. And, you know, their daughter's sitting in the room and they're like, I didn't know that my mom did that. And so it's just a cool opportunity to just talk about life, and you'd be surprised what your loved one can remember and what you can learn. So it's a pretty cool opportunity, I think. So how to select this preferred music? There's lots of options. I know it's not always possible, but you can always start by asking, right? Ask your loved one what they prefer to listen to. You may already know, you may not. You may not be sure. Using music that has personal significance is usually a pretty good place to start. So, like Sherry mentioned, the first dance at the wedding song, that would be a great song to use. Something that has personal significance. I know for myself, my mom always tells me that she can remember the song that was playing on the radio when I was born. Right after I was born, they were brushing my hair. She remembers which song that was. So if you know those songs that have personal significance, pulling those would be a really good choice. If you're not sure if there's any songs that have personal significance for your loved one, using songs from popular styles, or if you know their preferred music styles that came out in adolescence to early adulthood. So if we're looking at teenage years to about 30 years old. This is the time in our life where we're really forming our identity. Adolescence, we're figuring out who we are. In our 20s and 30s, we're in many cases establishing our careers or getting married or having children. And those are really important milestones in life that stay in our crystallized memory that we can access through music potentially. So using music from that time frame in someone's life could be really powerful. And then of course, trial and error. If you're not sure that your loved one likes classical music or not, you can always try it. If they don't like it, then you don't have to use it again. Similarly, you may find that sometimes songs with words may not be as successful as songs that don't have words. So those are little things that you can try and remember. Of course, our goal is always to improve quality of life. We don't want anyone to get upset or agitated. And so if you know the songs that your loved one likes, that's always better. But sometimes we just have to try. And also with trying, I would say consistency. So if we try it once, like for example, at bath time, let's say someone gets a little agitated during bath time and we want to see if using music can help with that. Trying it one day may not be as helpful. So I think that consistency and being patient is really important because every day is different and everyone needs time to process. So I think if you find a song or a set of songs that you know your loved one enjoys, try it in different settings and see, what works and what doesn't. Oh, using it, during bath time isn't really helpful, but using it during mealtime is helpful. And then you can begin to establish kind of a routine of when to put music throughout the schedule of the day in moments that will improve quality of life. And so those are just some of the thoughts that I've taken from my experience, that you don't need to be a music therapist to do these things. And that key, again, always I want to emphasize is that preferred music, because that's really going to be where the magic happens, I think. So the takeaways I kind of already mentioned is using meaningful, personal, preferred music, trying it again, repetition is really important, and try different things. So like I said, if maybe you notice that classical music doesn't work, we don't use classical music again. If we want to remove words, that could work. I remember one patient that I had sometimes would be okay with guitar and singing, sometimes would not be. And so maybe I would just sing, I would take away the guitar, or maybe I would just play guitar and take away singing that day. And then the next time I went to go visit them, maybe I could play and sing again. And so just trying different things and really, really maybe keeping a journal of what works well and what doesn't, so that you can kind of develop this, like I said, almost music program for your loved one, if you find that it's something that they respond to. And then the last thing I do want to emphasize is that this is not common, but it is possible that maybe your loved one doesn't respond to music in that way, and that's okay. But music is such a part of our everyday life that there's probably a song or a style of music out there that we can make a connection to. So I always like to give that caveat. Sometimes it doesn't work. Sometimes, like I said, everyone has different days. We have good days and bad days. Maybe if there's a day where we woke up and our routine was off and we're having a tough day, may not work the same way. And that's okay too. So that goes back to that repetition and trying different things. That is what I have for you today about how you can use music as a tool at home for your loved ones.